Welcome to The Explainer. Today, we're tackling a tough one, Delhi's air pollution. We're going to break down just how lethal it is, but more importantly, we're going to look at a real, budgeted plan that could actually fix things.
You know, every single winter, the smog rolls in, the air gets thick, and we all ask ourselves the same thing, right? Is this just normal now? Is it just a seasonal thing we have to put up with?
Well, the data tells a very different story, and the answer really comes down to this one absolutely staggering number.
17,000. That's how many people died prematurely in Delhi just last year because of air pollution. Think about that. That's 1 in every 7 deaths in the city. So no, this isn't just some seasonal annoyance. It's a full-blown public health catastrophe happening right now.
Okay, so let's really get into this. We're going to move beyond just the daily AQI numbers you see on the news and look at the actual devastating human cost. And the impact, it's been measured, and it's just devastating. We're talking about direct links to things like heart disease, strokes, lung cancer. I mean, these are killer diseases. And what's really terrifying is what it's doing to our kids. Doctors have found that millions of children in Delhi already have reduced lung function. That's a health problem they'll have to deal with for the rest of their lives. You see it in the real world, too. Whenever the AQI spikes, hospital ERs are just flooded. This isn't some abstract risk. We're talking about real people, real families, going through absolute tragedies.
So you have to ask, right? If the problem is this bad, and we all know it, why is Delhi still suffocating? Why isn't this fixed? Let's peel back the layers and see what's really blocking progress.
It turns out it's not really a technology problem. It's a system problem. First, you've got this mess of different agencies where nobody is really in charge, so nobody can be held accountable. Then you've got politics. It's way easier to get votes for a shiny new metro line than for long-term, less visible stuff like cleaning the air. And here's the kicker. Some powerful economic interests actually make money from weak pollution rules. Add to that the fact that pollution doesn't care about state borders, and you've got a recipe for disaster.
And that brings us to maybe the most frustrating part, the money. Or rather, the money that's not being used. Take a look at this. Under the National Clean Air Program, Delhi was given over 42 crore rupees to tackle this. Great, right? Well, look at how much was actually spent. Less than 14 crore. So almost 2/3 of the money that was supposed to help us breathe, just sat there, unused. It's unbelievable.
So, what's the bottom line here? It's a really unfair situation. This chart lays it out perfectly. There are clear winners and losers. Real estate developers, polluting industries, they benefit from the status quo. And who pays the price? Well, we do. With our health. The public health system pays for it. And, most heartbreakingly, it's the poorest families, the ones most exposed, who often pay with their lives.
All right, so given everything we've just seen, the analysis starts asking some very direct, very pointed questions to the government. Questions that, so far, have gone unanswered.
First up, and it's the most obvious one. We just saw that millions of crores are going unspent. So, why? Why is this critical funding to save lives just sitting in a bank account while people are literally suffering and dying?
Next, a pretty basic demand, transparency. Where's the public report showing all the money spent on pollution control over the last 5 years? I mean, how can we hold anyone accountable if we don't even know where the money is going?
And finally, the big one. Are we ever going to get pollution targets that have real consequences? Not just suggestions or goals, but legally binding targets with actual penalties if they're not met. Will clean air ever become a non-negotiable duty?
But here's the thing. It's easy to get frustrated, but this isn't just about pointing fingers. The most important takeaway here is that this crisis is solvable. Seriously, the solutions are out there, they're practical, and we even know how much they cost.
So what's the goal? It's ambitious, for sure, but it's crystal clear. Cut our exposure to major pollutants by 40%. And not in 10 or 20 years, within the next 3 years.
So how do we get there? Well, there's actually a step-by-step emergency plan. In the first 6 months, it's all about strict enforcement and making real deals with neighboring states. Then, over the next couple of years, we launch a massive program to protect kids in schools and hospitals and really crack down on industrial pollution. And then we accelerate the big stuff like upgrading public transport. It's a real roadmap.
Okay, but here's where we hit the big wall. Money. A real high-ambition plan would cost somewhere between 5 and 15,000 crore rupees. Now compare that to what's actually being allocated. A few hundred crore here, a few dozen crore there, that went unspent. The investment we're making is
It's not even in the same ballpark as what's needed to actually solve the problem.
So when you see a gap that big, it's easy to feel helpless. But we're not. So what can we do right now? Well, the thinking is that it's a two-part strategy.
First, there's protecting your own family. Simple, practical stuff. Wearing a proper N95 mask on bad air days. Being smart about when you ventilate your home. And a big one, not burning any waste and pressuring your local RWA to do better. These things really can reduce what you and your family are breathing in.
But let's be honest, we can't just mask our way out of this. That's why the second part is so crucial, civic action. This means using tools like RTIs to demand answers about that unspent money. It means demanding public dashboards so we can all see what's being done or not being done. And maybe the most powerful thing we can do, make public health a non-negotiable issue when we vote.
And, there's another angle to this that hits people right in their wallet. This isn't just a health issue, it's a financial one too. Studies are starting to show that terrible air quality can actually drag down property values. So this pollution isn't just threatening our lungs, it's a real threat to the long-term value of our homes.
And a really concrete thing we can demand is an indoor protection program. Think about it. We treat vaccines like a public health essential, right? The idea is to treat clean air the same way, at least for the most vulnerable. Let's get HEPA purifiers into every government school, every public clinic, every shelter. The cost for a pilot program is tiny, a fraction of what we'd save in healthcare costs. It's a total no-brainer to protect those who need it most.
So here's where we land. The situation is dire, no question about it. But the key thing to remember is that it's not hopeless. This is a solvable problem. We have the plans, we have the technology, so it all comes down to a choice, really. A moral question for our entire society. Are we really willing to trade our children's lungs for short-term profit?